The purpose of this video is to teach all the physio students the importance of role of physiotherapy in COVID-19 cases so that they can come forward to help people in this pandemic. COVID-19 affects different people in different ways. Most common symptoms: fever, dry cough, and tiredness. Less common symptoms: aches and pain, sore throat, diarrhea, conjunctivitis, headache, loss of taste, or rash on the skin. Serious symptoms are difficulty in breathing, chest pain, loss of speech or movement. Following instructions are needed. Do not let the happy hypoxia damage your lungs and make your case critical to manage. Happy hypoxia is an unusual complication arising in COVID-19 patients. This will not make you feel breathlessness or any difficulty even if your oxygen level is below 80%, but inside it damages your lungs and make your condition serious. Please seek immediate medical attention. Dear students, I hope this video will help you all to make your presentations and to come in practice. I request you to watch video till the end. Hello my dear friends, welcome back to my channel. It's me Shafaque. Friends, many of us are aware of the role of medical specialists and nurses in the treatment of COVID-19 patients. So today I'm going to tell you about the pivotal role of physiotherapists in COVID-19. COVID-19 is not simply a pneumonia or respiratory virus. The pathophysiology shows infiltration of inflammatory cells and elevated responses to inflammatory proteins such as cytokines, resulting in damage to internal organs and acute respiratory distress syndrome. COVID-19 causes disseminated intravascular coagulation, disrupting blood clotting, resulting in thrombotic events such as deep vein thrombosis, pulmonary embolism, COVID dose, and stroke. Physical therapy can mediate the deleterious pulmonary, respiratory, and immobility complications following COVID-19 using graded exercise, respiratory exercises, and manual hand-on therapy when necessary. Physiotherapy not only assists medical specialists in the course of treatment of COVID-19 patients, but also has definite preventive role for non-COVID people. Now let's focus on physiotherapy for critically ill COVID-19 cases. Physiotherapy starts from ICU in aiding the recovery of COVID-19 patients. The physiotherapist can facilitate the more energy-conserving techniques of breathing and mobilization, which not only promote enhancement in the oxygenation required for patients who have low oxygenation due to breathing problem, but also in boosting their immune system, which will in turn help them fight against the disease. Airway clearance techniques to clear the lungs from secretions and keep the lungs patent is a vital role of physiotherapist. Positioning and early mobilization of such patients are performed by the physiotherapist, which help in prognosis of COVID-19 patients. According to leading physiotherapists, after COVID-19 patients are discharged from intensive care, there is deconditioning, and they can develop a post-ICU syndrome, which basically leads to weakness or wasting of muscles along with emotional and mental symptoms. Physiotherapists are trained to develop the progressive exercise protocol for such patients to counter the weakness of muscles and optimize their functional outcomes. Moreover, physiotherapists can motivate such patients to create a sense of well-being in them. Now let's focus on physiotherapists' role in non-COVID cases. Physiotherapy can help the people who are not in COVID-19 category, but only precautions alone cannot protect us against the virus. Rather, we must focus on boosting our immunity by having a good combination of balanced diet, which should include foods rich in micronutrients such as vitamin C, magnesium, zinc, and antioxidants, and physical and breathing exercises. Yes, breathing exercises must during pandemic. Breathing exercises help in reaching the full capacity of lungs, and incorporating them into our lifestyle can prove beneficial during the pandemic. To fight medical, financial, and social stress in current times, simple breathing exercises like the diaphragmatic breathing technique, pulsely breathing, and thoracic expansion exercises promote the much needed relaxation. The first one is the diaphragmatic breathing. Sit comfortably on a chair with relaxed shoulders and place your hands on the diaphragm. Now, inhale through the nose, allowing the stomach to go out, and then exhale through the mouth. Performing it 3 to 4 times a day will stimulate the diaphragm. Next breathing exercise is pursed lip breathing. For this exercise, take in a deep breath from the nose and hold it, and then exhale slowly via the mouth via pursed lip. This will create a small positive pressure which prevents the collapse of airway. This is pursed lip. And next, thoracic expansion exercises. For this exercise, you have to inhale a deep breath from nose while taking the hands outwards and bringing back the hands while blowing the air out from the mouth. This helps in promoting the expansion of thorax, and it eventually creates more space for air to enter. And yes, rest is important to recovery. It is also essential that you are active as you can be to rebuild your strength. This will also help your lungs to recover. It is common that energy levels are lower after a period of illness, so it is important to start rebuilding your routine and activity slowly.